Hi everyone, welcome back to my channel. I'm so excited to be chatting with you all. So today I'll be talking to you guys about prelim year versus transitional years. What are they? How many should you be applying to? And which one should you be applying to? When you graduate med school and you start residency, which is the training after medical school in the field of your choice, every first year resident is considered an intern, and your first year of residency is always considered an intern year. And when you decide to do a specialty program such as dermatology, ophthalmology, rad-onc, anesthesiology, and a lot of other specialty fields, they require that you do a year of general medicine. So you have your prelim year where you can choose between general medicine, general peds, or general surgery, and you work as a first-year resident, as if you were a first-year resident in that field. You can also choose a transitional year where it's geared towards people who are all going off to another program their following years. And they have decided to do a training where you get to do internal medicine, you get to do rotations in general surgery, and a whole bunch of other electives. It usually tends to be easier. And people call that a fifth year of medicine and call it like their relaxed year before going into their specialty training. Prelim years are considered to be much harder because you are doing the same thing as what a person in that field would be doing in general. Some programs may make your rotation a little bit easier. Some programs may make it a little bit harder because they know you're going off into another specialty. It just depends. But a prelim year focuses in that one specialty, either general surgery, general peds, or general medicine, which is internal medicine, or in transitional year gives you a more all-rounded experience. So there are a lot of questions that come with which one to choose. I applied to both. I didn't really care which one I got into. I more wanted it to be in a specific location, which is why I wanted to maximize my chances. I know there's always the question of, I want the best training possible. Which one should I apply to? Intern year really is a year of getting to understand the ins and outs of medicine. And what I mean by that is like understanding how the hospital runs, understanding like how to put in consults, understanding like what the nurses do, what the techs do, and then understanding how all that comes together into formulating a plan. Because as the intern, you're doing a lot of the day-to-day, what they call is scut work, but I think it's a great way to understand of like how the hospital flows, because you're the one who will be putting in the order, you're the one who's going to be navigating to any other healthcare professional in your patient's team, putting in the consults, contacting different consult teams, doing all the discharge paperwork. So you're really getting to understand more the basics of like how medicine works. And then along the way, you're picking up how to be a doctor as well. I really don't think choosing between a transitional year or a prelim year, hard or not hard, is going to change that. I felt like I was in what's considered a harder prelim program, and I don't know if I would say that I'm like a way better doctor from doing a harder program. I really don't. I think that I'm already 3 months into being a derm resident, and a lot of the things that I probably learned in my intern year I'm already forgetting. So maybe ask me in another few months. It helps you and it gives you the foundation, but I think doing something harder isn't going to make you be better at being a doctor, especially for just 1 year. I think that you should just apply to the program that you want to. I don't think you need to challenge yourself and do a harder program. I know a lot of people give opinions on what they think you should do. Another popular question is, how many programs should you apply to? So I think historically these programs were these programs are much easier to get into compared to your specialty programs, especially if you're applying to one of the really competitive programs, such as dermatology, such as ophthalmology. And a lot of people I know were like, I'm only applying to 5, like I know I'll get in, or I'm only applying to like 2. But my experience was that it was pretty competitive, and I think it all depends on where you're applying to. I was applying to Philly. We already have several medical schools in the area. We have people who want to stay in the area, and And then you also have like a lot of people going into specialty programs. So getting into these programs, you're competing not only with the best in your field, but you're also competing with the best in other fields. So I did not get as many interviews as I wanted. So granted, I got into the program that one of the programs that I did want to go to. I felt like I didn't get a lot of interviews in the places that I would have liked to try to at least interview at. With that, and now with COVID, which makes things a lot more unpredictable, I would say you should try to apply to more programs rather than less. Applying to probably about 15 to 20 programs is what I would suggest. Apply to more if you are apply more on the 20 side if you're applying to a more competitive location, and apply to not only a more competitive location, but if the program you know is a well sorted out program and you have a lot of those on your application, then try to apply to more rather than less. And if you're in a less competitive area, then for sure you can apply less. But it's better to be safer than sorry, because you don't want to scramble and then end up like in the middle of nowhere doing your program. Unless you don't care, of course, then it doesn't matter. But that's just the advice that I would give. If this was helpful to you, make sure you press that like button so I know that you enjoyed it. If you have any questions, please let me know by leaving a comment. If you want to keep up to date with all of my latest videos, be sure to subscribe to my channel so you know exactly when I am dropping my next video. I drop videos every Sunday when I'm able to, based on my schedule. And if you want to get to know me a little bit better, make sure to follow me on Instagram at @therealskinim_MD. You guys have a good one. Bye.